Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, brought to you by UMass Memorial Healthcare. I'm joined by Dr. Chang, and we're here today to talk about opioid use and teens. So my first question for you is, how prevalent is opioid use in teen population?
So thank you for that question. I think, honestly, it's a very tough one to answer, also because our conception of what constitutes a teenager is a little bit different. We're typically used to thinking about teens as running up until age 18. I think a lot of pediatricians in practice actually treat patients up into age 21. What I have in terms of statistics actually cover the ages from 18 to 24 simply because there's not a lot of data in terms of opioid use, especially fatality rates in ages younger than that range. So looking back to 2014, off of the Department of Public Health Massachusetts website, it was estimated that basically up to 25% of fatalities occurred in the 18 to 24 age range. That's extremely high. And for sort of one substance to kind of cause 25% of fatalities, that's unfortunate, and that kind of points to the end of sort of the substance use and opiate use disorder spectrum.
Is this younger age group affected by the opioid epidemic differently from adults?
I would say yes. And one of the main things that we have started to recognize really as pediatricians treating this age group is that brain plasticity, and what that means is just the brain's ability to process information, to be changed by it, actually occurs up until really the mid-20s. So anything that affects one's ability to learn, to make memories, to have experiences, can be really affected in this age group. So that means any substance use, whether it's cocaine or opioids, heroin, can really affect someone at this age. So it makes people very vulnerable.
How does the strategy for caring for an opioid-addicted teen differ from that of an adult treatment plan?
I think the most obvious difference is that you have to involve parents, and you have to involve whoever is providing care for the adolescent or teenager. There are a lot of non-traditional families, I should say, that also have been affected by this issue. And so I think as healthcare providers caring for adolescents with opiate use disorder, I think that becomes the most challenging part when you don't just have one patient from you, but actually have multiple parts. So it becomes something that you need to sort of keep in mind.
What methods are available to reduce harm caused by opioid use in teens?
The thing that most immediately comes to mind that parents and caregivers can do is actually go through your own medication cabinet and actually figure out, all right, what's there? I think it's a question we as healthcare providers actually don't ask enough as well. A lot of prescription use and opioid use disorder first starts because a teenager or a child discovers a medicine that is left over, an opioid, in the medicine cabinet. So I think being knowledgeable about what's in the house is very important. The second big thing that I would encourage families and people interested in this issue to get knowledgeable about is naloxone. So this is something, it is a reversible agent against opioids and heroin that is available at all pharmacies, actually, in the state of Massachusetts without prescriptions from a doctor. Obviously, there is a cost attached to that, so doctors can prescribe this. So this is a conversation I think everyone should have at some point with either a pharmacist or a doctor.
How can a parent or teen learn about medication-assisted treatment options for opioid use issues?
I always wish, and my hope is that one day families can talk to any of their primary care providers, be it their pediatrician, an internist, a family medicine doctor, about this. What people, I think, do not know is that primary care doctors can prescribe things like Suboxone, which is a very commonly known agent, I think, in the public nowadays for medication-assisted treatment. What the providers have to get is an actual training course to actually prescribe it, so it does require one step from the providers. However, I think one barrier is that a lot of primary care providers don't know that their patients are affected the way that they are from opioid use, be it an adolescent or be it a young adult. And so pediatricians now actually have courses that are available to them to actually, get training on managing opiate use disorder in primary care settings that are available throughout central Massachusetts and the state.
If a teen is prescribed an opioid following an injury or a surgery, what can a parent do to monitor their use?
Biggest thing is to actually encourage your teenager to be an active participant in their health and to actually be engaged in evaluating their level of pain. I think without that level of honesty, unfortunately, that's where a lot of things happen. I think the next thing as a parent and as a caregiver is to be very knowledgeable about the nature of injury as well as the nature of surgery that your child is getting. So that might mean a conversation with your doctor in terms of how quickly is this injury going to heal, or how quickly is the surgery going to heal, because that often will govern the pain plan. The third, I think big question to ask out of all of this is, does my child really need opiate medications? Sometimes they do. And in that case, I think the follow-up question is, how do these opioid medications work and what can I expect? So I think those three things are really important to keep in mind, just in terms of, what to expect when, your child does get seriously injured or actually is going to undergo a surgical procedure.
If I suspect my teenager might have an opioid addiction, what should I do?
First thing to look for, some telltale signs. One of the big things is that a lot of opioid use can mimic other things. So like depressive symptoms, sort of being withdrawn, and sort of not acting the way they normally would. So those are very subtle signs that may mimic other things. That should prompt a conversation at least. If they really are taking substances, they may not be forthright. The other big thing with opioid use in general, and this includes heroin, which is also a form of opiates, is that it costs money. So anything like money disappearing, anything like your medications disappearing from your medication cabinet or things like that, are things specifically to look out for. And other signs which can indicate that your child is actively using can actually be, if they're having moments of being sick, either to their stomach or having sort of issues like watery eyes, a lot of things like nausea, vomiting, and things of that nature. The specific thing about opiate use disorder that is different from other substances that can really be telltale signs is that, people withdraw, and adolescents are very much like that. They don't, this spares no one. So if they hit that period of withdrawal and are sort of saying, I'm sick, all the time, and you're starting to suspect that this happens in a cyclical pattern, opiates may or may not be the cause, but you can sort of start to put two and two together. And I think those are sort of signs to sort of start to go to your doctor or your primary care provider and say, something's up. I really need my child to be seen. I really need a thorough, careful history and a physical exam to be done at that point.